And now, we bring you the following live press announcement from D.C. Mayor Muriel Bowser. Our regularly scheduled program will resume following the announcement.
Good morning, everyone. I'm Muriel Bowser. We are in the Marion Barry building in Washington, D.C. for an update on the district's response to COVID-19. Today I'm joined by Dr. LaQuandra Nesbitt, the Director of D.C. Health, City Administrator Kevin Donahue, State Superintendent Christina Grant, D.C. Public Schools Chancellor Louis Farabee, Deputy Mayor for Education Paul Kine, and the Executive Director of the D.C. Public Charter School Board, Michelle Walker-Davis. Today, as you can see, we're joined by our education leaders because today's update will be focused on schools and how we can continue to protect our students, educators, school staff, and families. I am showing a chart that shows how we are doing with vaccination in the district by age group. You can see that just about 90% of DC residents who are 65 and older have had at least one dose, and that's very good news, but we still have significant work to do with younger people. We need our younger residents following the lead of their older family members and neighbors and to get vaccinated. You will remember that in August, we announced a policy requiring all DC government employees to be fully vaccinated or to be tested weekly for COVID-19. That policy went into effect September 19th, or yesterday. And as of today, 87% of employees have submitted their vaccination status. From these responses, we know that 72% of DC government employees are fully vaccinated. Beginning this week, those government employees who are still not fully vaccinated must begin providing weekly proof of a negative COVID test. You will remember that this requirement is separate from our requirement for healthcare workers. And that requirement goes into effect on September 30th. And today, we are announcing new requirements for those adults who work in DC schools and DC child care facilities. So by November 1st, all adults who regularly are in schools or child care facilities in DC must be vaccinated against COVID-19. This applies to DC public schools, public charter schools, private schools, parochial schools, and child care facilities regulated by OSCE. And this does not include a testing out provision. You can see I am also showing a list of the adults who we consider going in schools regularly, and we will provide, of course, this listing on all of our electronic, by electronic means. But just to give you a flavor, teachers, of course, student teachers, teachers' aides, substitute teachers, and teaching fellows. Before and after school providers, guidance counselors, social workers, school bus drivers, school security personnel, coaches, trainers, athletic directors, referees, principals, and all school leaders, program coordinators, and administrators, librarians, and school library-based personnel, technology support personnel who work in schools, and cafeteria, janitorial, and building maintenance staff as well, aides for children with special needs, and volunteers who work regularly at the schools. So not only, this is the full universe, we believe, of adults who work regularly with children in our schools. That's all DC public schools, public charter schools, independent schools, and child care facilities. It's also, I want to talk more about children now. And after November 1st, our student athletes who are eligible for that vaccine, who are 12 years and older, must be vaccinated. So after November 1st, 2021, all student athletes 12 and over must be vaccinated to participate in school-based sports. Student athletes who will turn 12 between September 20th and November 20 must be fully vaccinated before December 13 to be eligible to practice or compete. And we will say a little bit more about that. I am also happy to announce a partnership between DC Public Schools and Howard University and a youth vaccination town hall that will happen this week, September 22nd, 6 to 7 p.m. And we will be joined by college students, medical school students at Howard's College of Medicine. Will answer young people's questions about the vaccine. And this week, DC Health and Howard Medical students will meet with students at 3 middle schools at Brooklyn, Sousa, and Johnson. As a reminder, students are eligible for giveaway items when they take the shot. Those items include a $25,000 chance at a scholarship, iPad and headphone winners each week. And you can find more on the website, of course, but the vaccine giveaway sites are Brooklyn Middle School, Sousa Middle School, and Johnson Middle School. We also want to remind you of all of the other vaccinations that we need our children to have and the deadlines that parents need to abide by regarding those vaccinations. Next, I want to turn to talking about school-based testing, and with that, I'm going to turn to Superintendent Grant and Chancellor Farabee, who will provide an update on school-based testing, and then Dr. Nesbitt will provide a brief update as well.
Thank you, Mayor Bowser. I'm pleased to share some information on the COVID-19 school-based testing program. For school year 2021-22, OSSI is pleased to be implementing in consultation with DC Health the district's school-based COVID-19 program. Our program offers 2 options: participation in our centralized program or to receive a sub-grant to contract with our own vendors. Our centralized program is being operated in partnership with testing vendor Shield T3. The program uses a saliva-based PCR technology, and it includes both asymptomatic and symptomatic testing. In the asymptomatic arm, we are aiming to produce a random weekly sample of 10% of students, and students and staff who develop symptoms of COVID-19 while at a school may also receive an on-site symptomatic test. DCPS and 41 charter LEAs are participating in this centralized program, and charter LEAs that have opted to operate their own testing program have implemented that program with various vendors. Today before you, I'm sharing testing data from the first 3 weeks of our program. The slide represents this data as we've begun the start of this school year under our centralized program. This does include DCPS and charter LEAs that participate in the centralized program. We've publicly posted this data online, and on Wednesday afternoon of each week, we will be reporting data for our centralized program. This information can be found at coronavirus.dc.gov. All positive cases identified through our school-based testing program are also reflected in DC Health's comprehensive data dashboard on all cases. Again, that information can be found at coronavirus.dc.gov. I will now turn it over to DCPS's Chancellor, Louis Farabee, to walk through DCPS reporting protocols.
Thank you, Superintendent Grant. Thank you, Mayor Bowser. Over the last few weeks, we've had the opportunity to enjoy the excitement of having our young people back on campus. We've seen our young people reconnect with their classmates, their educators, their coaches, and friends. We know that the best place for our students to learn and continue to thrive is in our classroom. We also want to acknowledge that this year feels different. but we are continually work with our health professionals and our teams to ensure that we assess, revise, and ensure that our environment is prepared for our students to learn. We again will continue to review all of our protocols, assess all of our strategies, and make adjustments and refine and strengthen our procedures as needed. Today, I want to share with you more about what happens when there's a reported positive case of COVID-19 and how that is handled in our schools. When a student tests positive through our testing program that is outside of DCPS, we ask that families notify us that immediately so we can begin to do our contact tracing. A student who tests positive should isolate for at least 10 days and cannot attend school in person or unless they are medically cleared to do so. Contact tracers work directly with school-based staff to determine who is a close contact based on CDC and DC health guidelines. Students in a classroom setting that are between 3 to 6 feet apart are not considered a close contact when we have mitigating strategies in place, just as we have in the past school years, such as fitted masks and also our ventilation efforts as well. Based on the determination of our contact tracers, we will communicate to those students that need to isolate and quarantine, and then we'll also remind families that any individual that is fully vaccinated does not have to quarantine. We also provide directions to families on how to continue to assess student symptoms while they're at home via our Ask, Look protocol. We are communicating directly to close contacts in a classroom. We also notify the entire school community when there's a positive case. We send that notification to families via email, and then we also post a community notice on our website as well. The letter we provide to family also provides direct information about the close contacts and also the positive case in the building. As I shared earlier, we'll continue to review, assess, and refine and strengthen our protocols and strategies, and we will continue a layered approach of mitigating the spread of COVID-19 in our schools.
I will now share with you all preliminary enrollment numbers. I want to stress that these are preliminary numbers, these are unaudited numbers, and the official count of students takes place per statute in October. Our robust enrollment process begins with count day on October 5th and takes us through the end of the calendar year. Our official count of audited numbers will be available in the enrollment audit report shared later this year. That said, we are monitoring our early data very closely in this critical school year, and over 90,000 students have already enrolled. It is important to note that we will always see movement during the beginning of the school year and count day, which again is on October 5th. But before you is, as of September 19th, the current enrollment status across the system, DCPS and public charter schools. We look forward to conducting our audit and sharing the audited numbers later this year, and it will give us the best insight into our student population over the course of student funding. But at this time, we are pleased to see families excited to return to school in person. There's also a preliminary metric, I'm sorry, one slide back, please, thank you. There's also a preliminary metric, but to date, with respect to attendance, we see that DCPS is reporting attendance that is similar to the attendance rate of last year.
Thank you. And I think you, Chancellor Farabee reports to me weekly as we see numbers go up, parents still enrolling their children in school, and you may still do that. Families that want to search all DC public schools, including public charter schools by name, grade, and ward, can visit myschooldc.org to fill out a post-lottery application. DC public school families can enroll directly at enrolldcps.dc.gov, enrolldcps.dc.gov. And Dr. Nesbitt, do you want to mention Any
Sure.
information on boosters such that it is?
Yes, thank you, Madam Mayor. So a lot of excitement over the past several days as it relates to boosters and additional doses of COVID-19 vaccines. We know that the COVID-19 vaccines are safe and they remain highly effective in preventing severe illness, hospitalizations, and death. The goal of booster doses of vaccine is to continue to reduce the risk of severe illness, hospitalization, and death in the eligible population for vaccination. While it is feasible that booster doses of vaccine may reduce overall risk for new infection and spread of the virus, based on the available science, it is not clear that this will occur. The FDA and CDC must continue to make recommendations for COVID-19 vaccines that focus on both safety and effectiveness, ensuring that the benefits of vaccines outweigh the risk of vaccination. Based on available data and studies, last week the FDA did not approve boosters of Comirnaty, previously simply known as the Pfizer vaccine, for the general public, and instead focused on approval of boosters for persons over age 65 and those at risk for severe illness. CDC's Advisory Committee on Immunization Practices is scheduled to meet this week on September 22nd and 23rd, and will make recommendations for clinical use of the Pfizer vaccine. As such, residents in the District of Columbia should plan to receive a booster vaccine only after the CDC's meetings occur, which will not occur prior to September 23rd. DC residents whose healthcare provider have previously recommended that they receive an additional dose of a COVID-19 vaccine due to an immunocompromised health condition should continue to do so. DC residents should expect that the recommendations for risk for severe illness may mirror the recommendations from the initial phases of the vaccine rollout. However, we should all be reminded that new data is always coming around, and new data regarding variants may influence the ACIP's decisions and recommendations. Furthermore, it is not expected that the CDC's recommendations for boosters will apply to persons who received Moderna and the J&J vaccine. DC Health will continue to follow recommendations of the FDA and CDC and continue to encourage everyone to get vaccinated, as vaccines remain the best and most effective way for us to end the pandemic. There are plenty of opportunities for people to get vaccinated in the District of Columbia. If you are 12 years of age or older and have not received your first dose of the COVID-19 vaccine, now is the time to do so. You can learn more about the over 150 locations where you can receive a COVID-19 vaccine here in the District of Columbia by visiting vaccines.gov. There are plenty of vaccines available in doctors' offices, health centers, and pharmacies throughout the city. And all of these locations offer appointments and even walk-in opportunities that are at convenient times to meet your schedule. In addition, DC Health continues to partner with many community-based organizations and schools to host pop-up clinics for youth, young adults, and in communities where our vaccination rates remain lower. If it's been a while since you've received your second dose of the COVID vaccine and you want to be ready for boosters when that time comes, we encourage you to locate your vaccine card, call your healthcare provider to discuss your options and prepare for a booster. And if you can't find your card, you can always visit myir.dc.gov or give us a call for more support at 855-363-0333. So again, stay tuned. We'll provide new information as we have it as to the state of booster doses of the COVID-19 vaccine. Thank you, Madam Mayor.
Thank you. Any questions? Yes, Sam.
I guess a couple of weeks ago, the Johnson Middle School, a sixth grader tested positive, and they sent 130 sixth graders home. I don't know, it just seemed a little dramatic, but how does it work? Who determines when you send, I understand their protocols, but who determines that the entire sixth grade class has to be quarantined, and is that, let's say, approved up the chain of command?
So I want to be clear that our quarantine strategy is a prevention strategy. It's designed as such to ensure that we mitigate the spread of COVID-19 among students and staff. We have a health services team where we've actually tripled the staff members there. We also have an additional 10 dedicated contact tracers on our team, in addition to over 240 patient care technicians that support our schools in COVID-related responses. When our contact tracing team receives a report of a positive case, they begin immediately to reach out to individuals that were in the classroom or in the school building to determine who's a close contact. Once that team determines who those close contacts are, we always follow their guidance and directive of who should quarantine. We also collaborate, that team collaborates with DC Health as well on those determinations.
So it's possible that an entire 6th or 7th grade class from a school could be sent home again?
It's possible. There are some unique environments that we have that leads to, in many cases, larger numbers of quarantine. Again, I want to be clear, it is a prevention strategy, but we have our youngest learners in our early childhood education classrooms that have unique settings. In our secondary schools, we do have situations in which students exchange classes and have multiple teachers and interact with multiple classes throughout the day, which could result in a larger number of quarantines.
Those students had adequate online education after they were all sent home for a
Yes,
week?
so certainly, as soon as there is a word and notification that we need to have quarantine of students, we immediately begin to ensure first that they have access to technology, there's an instructional plan for those students, and that the learning process continues for those students while they're quarantining.
Yes, Mark?
Maybe this is for Dr. Nesbitt. I'm wondering if you could define regularly in school. And what I'm really wondering is for parents, it says volunteers in your list at school, but for parents who regularly go into a school to drop their child off, pick their child up, particularly in childcare settings where the drop-off routine and time is a little bit longer than, say, you know, a middle schooler who you're just driving by and dropping off. Is there a scenario where parents have to be vaccinated in order to go in?
That is not a scenario where parents have to be vaccinated, but schools might want to address their protocols where they don't have a lot of adults lingering in the buildings. I know that many schools, for example, that drop-off happens outside, and I would encourage those school protocols to be careful about that. Yes, ma'am.
I have confirmed and reported instances in which unvaccinated staff members have exposed students on the charter and DCPS side and led to students being quarantined. Can you talk to me about those instances and how and if that shaped your decision to call for this mandate today, the fact that unvaccinated staff members were leading kids to quarantine? And if not, what changed your mind today to toughen this mandate?
Well, Perry, our positions around interventions have evolved as the pandemic has evolved. We have been very focused on getting government employees vaccinated throughout, working with our labor partners throughout. We know that the vaccine, at least one of the vaccines, has gone through the entire approval process. And we feel very confident that our staff have really accepted and adopted the vaccine for the most part. Now, there are others who have not, and we are requiring them to do so, and to do so by November 1st. It's very clear, especially for our young people who are not eligible for the vaccine yet, that the best way to protect them is to have the adults around them vaccinated, in addition to all of the other mitigation strategies that we use. Yes, ma'am.
Clarity from WTOP. It's been a while since I've been here.
Yeah.
I have a question about, we did a story 2 weeks ago, we were in touch with Deputy Mayor Kine and the Chancellor about this. A family said their kid was sent home, had COVID, they're okay. But they were wondering, first of all, if outdoor lunches are being considered as an option. It seems to me, and it seemed to this parent, that it would be an obvious solution to keep kids farther away from each other, keep the airflow going. And I'm also wondering how many children right now are in quarantine in DCPS schools.
Wants to take outdoor lunches?
So I
Okay.
can speak to, currently we have 1,400 plus students that are current quarantining. That number changes each day as the number of students that are in quarantine are either added or subtracted. We have been supporting schools with outdoor activities, whether it be outdoor learning, outdoor lunch, and many schools do maximize that space. However, all of our campuses don't have the same footprint and the same structures to accommodate that. And of course, the sizes of our student populations vary significantly. In addition to that, we have some weather challenges that prevents us from always maximizing the outdoor space. And then we also want to preserve our outdoor space for physical activity as well. We have also supported schools in securing furniture for outdoor activity and storage space for outdoor activity along with tents as well. We will continue to support schools as they host activities outside, whether it be lunch or outdoor learning. And more importantly, it's important to call out that in our cafeteria and large spaces, gymnasium, we do have larger HEPA filters that are in alignment with our ventilation strategy that we have in the classrooms.
I'll also add that the outdoor space work we've done is not specific to DCPS, but has been true across the public charter sector as well. The Charter School Board has hired consultants to provide individual consultations to schools, including on the use of outdoor space. OSSI has been working for months to provide tailored technical assistance on a school-by-school basis, as well as standing up a resource hub for schools that want to take advantage of it.
Just a quick follow-up. So for the schools who have the space, should that be something that you guys mandate that they use that space? It seems, I mean, if they have it and they're not using it, is it a case-by-case basis, or is it something that the city would consider saying, hey, get them outside?
No, it is not something that we are going to put a one-size-fits-all for every campus on. Listen, we have a group of professionals at the school who work with the teachers, work with their space each and every day. And parents also are working with those principals and teachers every single day about what works for their school. Yes.
Hey, Bill with Axios. I'm just looking at the numbers, and charter schools account for over 2/3 of cases, it looks like. Is there just sort of a reason or explanation why you all think that might be?
What chart are you referring to?
It looks, so public charter schools have about 181 cases.
What are you looking at?
This is school-associated cases in DC.
Okay. Does that go, what date?
August 29 to September 15.
Mm-hmm.
Are we seeing more cases in charter schools still now? Or
I'm not exactly sure what chart you're looking at, but we know that a number of our charter schools started school before August 30th. And so we did, in the early week of reporting, saw more charter cases than DC Public Schools, largely related to their start date, we think. We don't think that we see anything to suggest that one sector has more cases than another sector, but the start dates have been different. Yes, Mark?
Would the requirement for the school staff also have the exemption for religious and medical, the possibility of requesting those exemptions like you're doing for?
I think that the language is the same.
It's the
yes.
same as for the healthcare license that we had
Yes.
last week. And then can you update us on that? How many requests for exemptions, medical and religious, have you received from healthcare workers and from specifically DC Fire and EMS?
I can provide an update.
Okay, Kevin?
Good morning. The DC government received about 475 religious exemption requests across government. 419 of those are from employees of Fire EMS. At this point, none have been approved. They're all going through the due diligence that is required under federal law to see if those requests comport with the requirements to be able to gain eligibility to a deeply held spiritual belief as the basis for an exemption.
How about the medical exemption?
I was told this morning it's a handful. I think it was under 10 when I asked this morning.
And then have any been denied?
None have been denied thus far. They're all going under the deliberation and scrutiny that are required under federal law.
And when you say this 475 are government, what about just healthcare workers in general, doctors, nurses?
We have not, I did not pull that data prior to coming here. I don't have that on hand.
But you have received some?
There have been some submitted to our
Can you say anecdotally, have there
portal.
been?
I think if you give me 1 second, Mark, I can tell you from last week. Last week I had, for licensed, and this does not include the FEMS, I had 316 requesting exemptions. 39 were medical, 270 were religious, and 7 were requesting under the World Health Organization clause.
Have any of those been denied? Or?
They have not been decided on one way or the other. And for unlicensed healthcare workers, 3 medical, 38 religious, and 0 under the World Health Organization option.
I very much appreciate that data. Can anybody update us about the firefighters and whether or not any suspensions have been started yet? I know that the deadline is the 30th, but I believe the DC FEM started on the 19th requiring the first wave.
Sorry, Mark, before I do that, can I give you some context? Because I don't know
Thank
that you have this for what 316 mean. There are 81,597 health professionals licensed in the district. So 316 is a...
And that would include DC FEMS?
That does not include DC FEMS.
That does not?
That's correct.
Thank you.
And I can provide some additional context. So certainly for the marriage order requirement that allows for a test out for both the federal exemptions, but also just a test out based on preference. By design, suspensions would not take effect until after employees have had a couple of weeks to be reminded of their obligations. So the initial interaction between the employer and an employee who has not complied is a reminder and then a conference. So suspensions and more punitive discipline will likely not happen until October for employees who, despite the verbal warnings, reminders, and instructions, have not provided a negative test. And that's also just important to highlight. This is also the first week that we have thousands of employees who will be required to get tested and show a negative test. So it allows for some period to work through sometimes the complex logistics of being able to do that smoothly.
Yes. Yes, your question.
Hi, I'm Chelsea Struth, also with Axios. I wanted to ask about outreach to younger age groups, vaccine outreach. Pfizer today said that its vaccine is safe and effective for ages 5 to 11. If the FDA grants emergency use authorization for that age group, how will DC provide outreach to the younger age group, and how might it differ or be similar to what's already being provided to minors?
Sure. Doc, do you want to talk about that, please?
Right. So I've said probably more times than not in the past couple of weeks, I'm more in the expectation management business in the past month than I've ever been before in my professional career. Let's be abundantly clear. If the FDA plans to submit in the coming, if Pfizer plans to submit in the coming weeks data to the FDA on the 5 to 11 population, there are still weeks that the FDA has to go to review the data and make a decision on the 5 to 11 population. And I think that's important to emphasize so we don't create this expectation that in a couple of weeks, 5 to 11-year-olds will be vaccinated. The outreach for 5 to 11-year-olds is really about parents. and getting parents to have confidence in vaccinating their children, and recognizing that it is the best way to eliminate a lot of the discussions that we're having in terms of disruption of school and in-school time and quarantine and isolation. Is the best protection that they'll have. We can't get ahead of what the data says in terms of the safety profiles for the vaccine, recognizing that it's effective and understanding the risk. So our strategy will be able to communicate to parents what that risk is and how the benefits of vaccination will far outweigh the risk. We have learned that parents prefer to go to their family doctor or their pediatrician for these services. It was true for the 12 to 15-year-old population. We expect it to be true for 5 to 11-year-olds, and we expect it to be true for 0 to 4-year-olds when it's their turn. So we will continue to focus on engaging healthcare providers in the District of Columbia to be part of that outreach. We are one of few jurisdictions that has a requirement for all of our licensed healthcare workers to have continuing education credits in COVID vaccination, right? So they have to have that by the end of September. They can choose things that are about how they should counsel people who have vaccine hesitancy, understanding all of the approved COVID-19 vaccines, doing modules that are created by the CDC. So there's a lot of work that we're doing to ensure that our healthcare provider community has all of the tools and resources and support they need to be able to counsel patients and families on making the choice to get vaccinated.
Perry?
Based on what we've seen from the few charter schools that have implemented already such a mandate like this vaccine mandate, it seems likely that DCPS and schools will lose some staff who do not want to comply with this order. We know there's a daycare worker shortage, there's a bus driver shortage nationally. My question is, how does the city plan to confront the challenges of staffing shortages while implementing this mandate?
We are always hiring, Perry, and we are a competitive employer. People like to work for us, and we are fair, we pay well, we have great benefits. And so we know that a lot of people are thinking about their employment, and they may also be thinking about coming to work for DC government. But that's always. So we will be hiring for bus drivers, we will be hiring for people to work in our schools, we will be hiring firefighters, we will be hiring. We are always hiring police officers, we are hiring. Having said that, we also expect our employees to comply with the terms of their employment, and we want to keep them on our team. We have spent the last 18 months during this pandemic trying to keep our team together. When we were facing a huge economic crisis, when we had to slash our budget, we didn't cut a single job. Okay, we've tried everything that we can do to keep our team together and to keep our team healthy. Our focus right now is on making sure our children stay in school, and the best way that we can protect them, not knowing when all of them will be eligible for vaccination, is to keep every adult that they interact with vaccinated. That's what the science tells us. That's what employers all over this country are moving towards, and that is where we will be. So we need our employees in our schools and are working with our children to get vaccinated by November 1st, and that is very important to how we keep our schools open and get over this virus. It's really that simple, and it's not something that is that out of the ordinary, especially for our healthcare workers at fire and EMS that we've talked a little bit about already. They're already required to get vaccinated, and so this is an addition to that. Our fire and EMS workers are in very precarious situations, obviously. They go into people's homes, they're providing health care in the back of an ambulance, they live together, they sleep in the same rooms, they eat in the same kitchens, they spend a lot of time together. So we see the extension of this mandate for our healthcare workers, especially our DC government employees, as the way to keep our community safe and get over this virus. Yes?
Quick question about, oh, sorry, James, would you want to?
The
You can go ahead.
I'll do quick. School testing, it's kind of along those lines. As far as monitoring symptoms of kids, we understand that, is it true that DC nurses that work in the schools are not really, it's not really their thing to monitor the symptoms until the testing comes? And who is monitoring those symptoms? I'm wondering, some schools have hired outside nurses, is that true?
So DC Public Schools, I mentioned earlier, has a wide range of health professionals on our campus. We have patient care technicians who have the primary responsibility for our isolation spaces when students show symptoms of COVID, and then they're also a part of our daily screening procedures when students arrive on campus.
Yes, James?
Chancellor Farabee, I have a question for Chancellor Farabee and a quick one for Dr. Nesbitt. Chancellor Farabee, what is the policy this year in terms of field trips? Are young people allowed to go out, or schools allowed to have field trips?
So right now we are restricting field trips to the region, capital region currently, and there needs to be a request from the school to have such field trips.
And Dr. Nesbitt, this is more of an academic question. You probably heard buzz around the country among your colleagues about this, I don't know what you call it, it's called Invectoring. And it has to deal with, some people say that it helps COVID, some people disagree on that. What are your thoughts about Invectoring?
Ivermectin, don't take it.
Yeah.
Don't take it, right?
Thank you.
So don't take it. Best way to prevent COVID-19 is to get a FDA approved or emergency use authorized vaccine. In the US, there's Moderna, Pfizer, now called Community, or the Johnson & Johnson vaccine. If you are infected with COVID and you require treatment, you should get a monoclonal antibody treatment. And we now have more healthcare providers who are making access to that treatment more readily available. Recently, Community of Hope joined in a partnership to create access points in the community for monoclonal antibodies.
Good.
That is what's safe for people to do.
Sam, okay, let's have one quick last round, starting with Sam.
Okay, I noticed when Dr. Nesbitt was reading these reasons why people weren't getting the vaccination, the one that outnumbered all of them was religious. What happens in a religious, if you have a religious, let's say, claim, does it automatically get accepted?
It does not automatically get accepted, and
so let's clarify. It's not a reason why they're not getting the vaccine. They have requested an exemption to a requirement to get the vaccine, which is it sounds nuanced, but it's different, right? So.
Well, but she was saying she didn't, basically she didn't want people around kids to infect them.
Right, but you said I was reading, but I want to
be
be clear about something. When you say I was reading reasons why people weren't getting the vaccine, I was reading requests for exemptions that people submitted to them.
Yeah, I grant that.
Okay,
Yeah,
I want
reasons
clarify.
people were claiming they didn't want to get it, but religion was way higher than anything else.
it is one of two reasons that people can claim an exemption.
So, but I guess the question is, based on what your concerns are, it's like, so what?
Well, I would agree with you, Sam, except there is the law, and there are things that we have to do legally to protect people's rights. And
so people's rights over people's health, is that how it works? Or?
no, it doesn't work that way, but I can't just rule out at this stage in the game a claim of a religious exemption.
So are you suggesting that they're going to be accepted, or they're going to be challenged?
I didn't accept that. They will definitely be reviewed vigorously. Any other questions? Yes, Perry?
I have two quick questions. One, a stat question about the attendance rates. I see you compared school year 2021 to this school year, but we know that last year was all virtual, so kids could, just log in once a day and get it. Do you have the comparison from fall 2019? I guess what I'm trying to see is, how many kids are, do we have a sense of how many kids are staying home because they don't want to, or their parents don't want them in school right now?
Yeah, that's a great question, Perry. We'll follow up with you directly on the stat for 2019.
Okay,
and just
great.
flagging that the number we provide for 21, 22 is as of last Friday. So
Got
it's
it.
not cumulative at this point, but I'll follow up with the
Okay, great.
2019 number.
Thank you. And Mayor Bowser, last time you made the vaccine requirement announcement, you specifically you said it did not apply to charter schools and early child care workers. Why does why the difference approach this time? Why is it now the mandate applying to charter school workers and early daycare workers?
It's applying to all schools or child care facilities, and we're using a different authority to do it.
And what is that different authority?
So it applies to the whole class of workers, not just DC government.
Okay.
Yes.
I have a question about Medicaid, if we can go a slightly
Sure.
off topic. Can I get your reaction to the council's resolution of disapproval? And I guess Mr. Mendelson in his letter suggested some kind of 90-day resolution or 90-day fix. I was wondering where that stands, if you can kind of clear it up for me.
I'm not quite sure where it stands with the council. I can tell you that we are very concerned about 65,000 people having to change health care plans in the middle of a pandemic. And these are residents who are least, I think, situated to deal with that kind of change. We have presented to the council a couple of different fixes to address that concern. And we are hopeful that they will withdraw that objection.
I think he said in his letter, and correct me if I'm wrong, because you know more about this than I do, but that the resolution of disapproval was saving the city from legal action because your order had gone against a judge's order. Is that right? I mean,
That's not exactly right. I don't have his letter in front of me, so I don't want to recount exactly what it said. But what we have done is presented to the council an opportunity to deal with any contracting issues that they think exist with a new contract. And not only a contract that addresses all of our needs that we had a year ago or a year and a half ago, but more in terms of allowing more mental and substance abuse treatment to be provided to our Medicaid population with the new contract. We also advance what I see as a stopgap between now and then, and those are emergency contracts to continue the process. I can't anticipate, nor do I think the council can, what legal action. There can always be legal action around contracts, but we think that this is a sound and legal way to proceed. Yes.
I have just one quick follow-up question, then two off topic, if I could. On the people who have requested exemptions, if somebody has an exemption, a request for an exemption pending, does that pause any requirement or any disciplinary action that could be taken, I guess, against DC government employees or people who are licensed if there's no ruling made by the time the deadline comes?
Mark, we'll follow up with you on all of the procedures to discipline, but all of our labor partners and staff should be pretty focused on meeting the deadlines that impact them.
And so if I could ask you two off-topic questions, just Wendy's at Dave Thomas Circle,
Yep.
Wendy's Corporation has put out a statement saying that they're still in court trying to seek a fair settlement for that site. They point to it being a somewhat iconic place for them because the circle is named after Dave Thomas. Can you give us any update or your thoughts on just the outcome of the settlement with Wendy's and actually when work will begin there?
I don't have the work start date, Mark, but this has been in our view, a long time coming. We've made it clear that we need the land. Anybody who knows how I approach things knows that I don't take a eminent domain proceeding lightly. And what eminent domain proceeding means, almost by definition, is that the property owner would be compensated fairly. And so we will go through that process. The district will compensate the property owner fairly, and we'll get a safer intersection.
Thank you. And could I ask you for just any comments on the uptick in violent crime in the Brightwood neighborhood that we have seen, and just your thoughts on what can be done there, and just on the recent violence?
We have a significant issue there. And I think I know those neighborhoods very, very well. And I'm extremely concerned at what I see as some back and forth violence, but very significant violence that's happening. Not only is the chief of police, and the deputy mayor for public safety, but all of our violence prevention officials are very focused on it as well. All right, thank you, everybody.